As we're increasing the capacity of the labs, okay, so now our 300 labs are getting more equipment, more supplies, they can do more tests. Now we need more collection mechanisms, more places to collect the test data so they can send it to the labs. We're going to authorize all the independent pharmacists in the state to be collection sites for testing. I assume, and my guess, and my educated guess, is that independent pharmacists will take us up on this. And there are 5,000 pharmacies in New York State. Some of them have already been doing it, some of the larger national chains. But if your local drugstore can now become a collection site, people could go to their local drugstore. There are about 5,000 in New York. And since we now have more collection sites, more testing capacity, we can open up the eligibility for those tests. Right. First responders, healthcare workers, and essential employees. Why? Because these people have been carrying the load, and they have been subjected to the public all during this crisis, and because they're public-facing. What are first responders? Firefighters, paramedics, EMTs, police officers, state, local, county, sheriffs, etc. Also correction, parole officers, probation officers, people who are in the prisons. Healthcare workers, broad definition, direct care providers, healthcare practitioners, medical specialists, occupational therapists, psychologists, psychiatrists, residential care program managers. So if you're working in a residential facility, mental health facility, etc., community group residents, you're now able to get a test. And quote-unquote essential workers, these essential workers, and God bless them, we want to make sure they are now eligible for tests, again, because they've been working all along. They've been exposed, and also because when you go in to the dry cleaner, this is the person on the other side of the counter who's interacting with dozens of people a day. We're also focusing on our healthcare workers and first responders. We're doing antibody testing for our frontline healthcare workers, and we're starting today, coming up to scale with 4 facilities in downstate New York, but Elmhurst Hospital, which made national news for the number of cases they were handling, Bellevue, Montefiore, SUNY Downstate is now running a COVID-only hospital. So everybody in that hospital is a COVID patient. And you want to talk about God's work, that's where it's happening. We want to get them the antibody testing. And we're also going to do significant antibody testing in downstate New York with those frontline transit workers also. People who've been working for the MTA, they're Transit Workers Union, TWU members. They've kept the city operational. You need those buses and you need those subways. If you want to have the hospitals running, if you want to have the grocery stores running, those employees have to be able to get to work. And then the police, the first responders who are out there because we have to be safe. And we have to be safe even during COVID. So NYPD was out there. They had large number of people who became sick because of the situation. State police, same thing. So we're going to be doing significant antibody testing there.